Okay. So let us start with a prayer. Okay. In the name of the Father, of the Son, of the Holy Spirit. Amen. Direct, O God, we beseech thee, all our actions by the holy inspiration, and help us on by thy gracious assistance, so that every prayer and work of ours will begin with thee, and by thee be happily ended. Amen. Okay, so let me share. Okay, can you see my slide clearly?
Yes,
Yes
po,
po,
Doc.
Doc.
Okay, yes. So for this afternoon, our topic is development, okay? So these are the learning objectives, and based on this, and this will be our outline. It's all about development, okay? The domains, okay? The different periods of development, the milestones, okay? And some red flags, okay? And we will end with surveillance and screening, which is basically application. So we all know that a child is a dynamic being, okay? And every child undergoes an orderly and predictable sequence of neurodevelopmental and physical growth, okay? And it is intimately related to the maturation of the CNS, and at the same time, continuously influenced by other factors. And these are the intrinsic and extrinsic factors. Okay, so it's an interplay of the central nervous system development, the environment, the nutrition, and other factors, which I will discuss in a while. Okay. So what are the intrinsic factors that influence development? Okay. These include the child's physical characteristics, okay, the state of health, okay, the temperament and other genetically determined attributes, okay, while extrinsic influences include caregiver's style of attachment, okay, to the infant, okay, the mental health status of the caregiver, the family's socioeconomic status, and all this will impact on the development of a child. Okay, the interplay of these factors make each child's developmental path unique from other children their age. So the interplay of nature or nurture, they both support child development, especially in the first 5 years of life. So, and in this short video, we will see how playing peekaboo can change the world. Can you hear clearly before I continue?
Doc, can you play po again?
Okay,
Parang wala po, Doc.
Walang sound, Doc.
walang sound. Okay, let me ask help lang. Or let me ask help lang from my side. Can you hear?
Wala pa rin po, Doc.
Wala pa rin. Okay. Wala pa rin. Sa ano? Characteristics. Okay, please tell me if you will hear some. Okay,
Wala pa din.
Still
wala pa
nothing.
rin daw. Wala pa din? Bakit pa lang si, si Chapo? Ano ba? Action. Okay. Ano yung password ko dito? Password mo siya. Ano ba ito? Cancel. Chat. Wait, let me try. Let me remove. Ano? Okay, let me try without earphones on.
Ari, say hi, Ari.
Is it okay? Is it okay?
And
Okay,
this
we'll
is
record
Lego.
here. Start it again.
What if I was to tell you that a game of peekaboo could change? What if I was to tell you that a game of peekaboo could change the world? Sounds impossible, right? Well, I'm here today to prove it's not. Hi, I'm Molly, and I'm 7, and this is my little friend Ari. Say hi, Ari. Oh, and this is my neighbor, Elmer John. He has to take Ari away now to get ready for our experiment. But don't worry, they'll be back. My talk today is about some powerful things you grown-ups can do that shape us as children and the adults we become. How do I know? Because my parents and people around me did them early and often. I know not all kids are as lucky,
Dok, nawala po yung sound.
Oh, I'm sorry about that, ha? So, 'pag pala nag-o-off ako, nagmu-mute ako, nawawala ang volume. So, sorry about that.
That would have.
Anyway,
That makes me.
okay. Let me just play it again. It's short naman eh, okay? It's very important one. So,
What if I was to tell you that a game of peekaboo could change the world? Sounds impossible, right? Well, I'm here today to prove it's not. Hi, I'm Molly, and I'm 7, and this is my little friend Ari. Say hi, Ari. And this is my neighbor, John. He has to take Ari away now to get ready for our experiment. But don't worry, they'll be back. My talk today is about some powerful things you grown-ups can do that shape us as children and the adults we become. How do I know? Because my parents and people around me did them early and often. I know not all kids are as lucky. Some of my friends, some kids at my school, and many around the world. And I would really like to help change that. Thanks to scientists, we now know just how important the first 5 years are for our health and development, especially our brains. Ari started learning long before he was even born, from inside his mummy's tummy. When Ari was born, he was tiny and he cried all the time. He was always hungry and he pooped a lot. Now he laughs and giggles and makes funny noises. But those are just the changes we hear and see. There's way more going on inside. So, let's talk more about our brains. The blue bag is the rough size and weight of a healthy baby's brain at birth. The red one is a baby's brain after the first year. It almost doubles in volume. And by my age, it's almost 90% the volume of an adult brain. Our brains develop faster in our early years than at any other time in our lives. It can create up to 1 million neural connections every second. But we need your help. Our healthy development depends on these top 5 things. 1, connecting. 2, talking. 3, playing. 4, a healthy home. 5, community. All of this helps our brains and us reach our full potential. So what's something you can do that can really make a difference? Scientists call it serve and return. That's just a grown-up way of saying connect, talk, and play with us. And here's the really big news. Amajot, Ari, you ready?
Ready?
Copycat games build imagination and empathy.
And
Naming games build vocabulary and attention.
Daddy. Ari. Daddy. Ari.
And games like Peekaboo, yep, Peekaboo, actually build memory and trust. Each time you talk to us, play with us, make us laugh, it not only builds and strengthens our relationships and mental health, it actually teaches us some of the most important life skills. From making friends, to taking a test, to getting a job, to one day maybe even starting a family of our own. Interactions early and often matter. Take it from me, the 7-year-old up here, talking about brain science. Okay, now, let's see what happens when the connection is taken away. So now he's trying to get his dad's attention again. He's reaching out like, that was fun, why have you stopped? I know it's important for adults to use their devices sometimes, but kids are hardwired to seek out meaningful connections. Not receiving them causes confusion and stress. Okay, Amajot, please re-engage.
Ate,
Now, what if a whole childhood was like that last 30 seconds? How hard it would be for a child to feel calm, to feel safe, to learn to trust anyone, and the lifelong impact that would have. That makes me feel sad. Ari only reacted the way he did and recovered so quickly because the connection between him and his dad is usually so strong. The positive relationships with the grown-ups in our lives gives kids the confidence we need to try new things, to explore, and be a kid. So please try remember the most special period for our development is the first 5 years, starting from inside Mommy's tummy. What's something really impactful you can do? Serve and return. And when? Early and often. Please give it up for Amachot and Aaron. It's an opportunity to connect, talk, and play. Imagine the difference we could make if everyone everywhere, to us, to children, it's so much more than just a game. It's our future. Thank you.
Okay. Did you enjoy the video, the short video? So connect, diba? Talk and play. And these are not happening when they are on screen, when they have gadgets in front of them. Okay? And that I take away all those benefits. Okay? Imagine those less than 5 years old during the peak of pandemic. Okay? Those only child with no interaction, with parents working at home. Okay? So the interplay of nature and nurture supports the child development, okay, especially in the first 5 years of life. So we saw how playing with children affects their development. So let's move forward to what we expect to see as they grow older. So the developmental milestones occur in a predictable and orderly manner, okay? The attainment of a particular skill builds on the achievement of earlier skills, okay? And this provides a systematic approach in observing a child's progress over time. It is organized into domains, and it helps in the recognition of its independence and interrelationships. So what are these domains? Okay, there are 7 domains, okay? 2 for motor and 2 for language, making it 7, okay? So the motor skills are further divided into gross motor and fine motor. So for the gross motor, these are the ones that pertain to the large body movements and posture, okay? It's like, what are the large body movements? Walking, running, okay? And we will observe that the development of gross motor progresses in a cephalo-caudal way, okay? This involves skills like, as I've said, running, jumping, and cycling, okay? Then we have the fine motor skills. While for the fine motor skills, this progress from proximal to distal, okay? And it involves eye-hand coordination. So from the pincer grasp to scribbling to drawing, okay? And then we have the social skills. And this refers to what? To attachment to a parent, self-regulation, interaction, and later on relationships, okay? While adaptive skills pertain to activities of daily living, such as eating, using the toilet, taking a bath, okay? Then later on, helping in household chores, and furthermore, community involvement. Then we have the cognitive skills, which involve attention and memory, reasoning, and problem-solving skills. Where language skills are subdivided into receptive, which focuses on listening, understanding, and comprehension. And then it involves understanding, gestures, and cues, okay, and questions, okay? While expressive language is the use of not just the verbal skills, but even the non-verbal skills, like eye contact, changes in facial expression, gestures, and then until they develop the single word or two-word phrases, okay? And then later on, them sharing stories, okay? Like the child shown on video. So after learning about the different developmental domains, let's look into the different developmental periods to see what happened in each age group. So during the newborn period, and this encompasses birth until first month of life, there is marked physiologic changes in all of the organ systems. So we observe the neonate responds to a wide range of sensory stimuli, which are your hearing, seeing, and touch. They learn to look at faces, okay? They discriminate the parents' voices from others, okay? They cry. They raise their chins when prone. So the attachment is also beginning, wherein they recognize their caregivers who meet their needs, okay? And this indicates a beginning sense of security for them. So we can observe the type of attachment they have with their parents at this time, especially with the mothers. That's why we also need to monitor for maternal depression because it may affect the quality of interaction and then later on attachment. We also see the different behavioral states of the neonate from being active to being quiet and alert and then sleepy and then crying again. And this is how the child self-regulates as well. Now, then the newborn moves to the infancy period. And this is the time when myelination is at its peak, okay? You have seen in the video, there is doubling of the brain volume on the second year of life, okay? And as the child grows, he also acquires a lot of new abilities in the different developmental domains, okay? They begin to respond and habituate to the familiar while being more attentive to novel stimuli, okay? They become more interested in the world, become sociable and mobile, okay? They are easily distracted while feeding, and they explore their bodies by how they start with staring at their hands, by blowing bubbles, and then touching their face. Slowly, they demand for autonomy, especially when they can move around by themselves. So as discussed, with the peak in neural plasticity occurring in this age group, the milestones progress dramatically and the infant acquires a lot of new abilities, okay? So from achieving good head control with hands open most of the time at 3 months of age, okay? They now also regard, they coo, okay? And they begin to cruise. And then they throw objects. And then they also stop when they are told no. And then they utter their first real word by the end of the first year. So they explore first by tracking objects until they learn to bang and shake toys. And then later on, there will be object permanence, okay? You try to hide a toy and they will look for it, okay? They have object permanence by around now here 11 months, okay? Now, upon reaching 2 years of age, there is remarkable growth and development, particularly in the social, emotional, cognitive, and motor areas. Because they are mobile, it allows for separation and increasing independence. They are thrilled with this newfound ability because they are able to explore. They climb tables, they climb cabinets, okay? And they control the distance between them and their parents. But toddlers tend to move close to their parents and return often, okay? A need for a reassurance from their parents. And now they also may start to manipulate objects in new ways, okay? They make believe centers on symbolic play like pretending to drink from an empty cup and imitation of parents or older siblings, okay? They imitate what they do, their facial expressions, and even what they say, okay? So they may call their parents by the first name if they hear that, okay? Temper tantrums emerge as they are unable to delay gratification, suppress anger, or verbally communicate well what they are feeling, especially with the use of gadgets now. You know, they do not have this patience that we usually see when we ask them to wait, because by a single click, they see what they need, what they want. So as they learn to walk and run, okay, they now, of course, display increasing independence. So they become more aware of their surroundings and also become self-conscious when they notice that they are being watched. Parallel play also begins at around 2 years of age, okay? Wherein, what do they do with parallel play? They play beside another child, but there is no interaction or cooperation taking place, okay? This might worry the parents, but if the child's age is 2, then reassurance and explanation, we need to give that to the parents, okay? So it's not good to put them in a play school, probably, or when you expect them to interact in parties, okay? They practice parallel play. And then we have expressive language skills rapidly developed during the preschool years, okay? This coincides with the time when children are exposed to an expanding social sphere. Language is linked to both cognitive and emotional development. So it plays a critical part in behavior regulation, because how could you express what you need, what you want, if you can't talk and you get irritated, you get the tantrums because you can't share or tell what you need and what you want. So they can't express their feelings. They also slowly learn to adapt to new rules at this age group, okay, and relationships. Now, play also increases in complexity and imagination, from simple imitation to more extended scenarios, okay? It involves learning, physical activity, socialization with peers, and practicing adult roles. They imitate what they see. It also allows for conflict and anxiety resolution, and it's a creative outlet as well, okay? So children by this time learn what behaviors are acceptable by testing limits, okay? It increases when it gains attention, even when negative, and when limits are inconsistent, okay? So this is what studies have always consistently show and tell us, that when you set rules, we have to be consistent. That is the important word there, consistency, okay? Because now it's okay, tomorrow it's not okay. They get confused with the basic, simple rules, okay? So if you allow this today, tomorrow you don't allow it, the next day you allow it again. So They get confused, okay? Temper tantrums may still be seen by this time. Now, a preschooler fine-tunes their skills from copying a circle to a triangle, okay? Speech becomes more complex and clear. And then they enjoy playing with a group of friends of mixed genders. They also become more independent in terms of self-care. They dress themselves up, they bathe themselves unassisted, they brush their teeth, okay? So these are the self-care that we observe among the preschool age children. As they get older, children increasingly separate from parents and seek acceptance from other adults, such as teachers and peers. So they begin to feel under pressure to conform to their peers and ideals. Okay, so they have this, the self-esteem becomes a major issue to them. So the home and family, though, remain the most influential. Cognitive abilities are also into play as children look into factors such as external and internal rewards. They begin to enjoy strategy games and wordplay. Let's look at other developmental milestones for school-age children. They attain further skills, complex skills, become more responsible, and can now be relied on to help around the house. So we can give them simple chores, okay? Now, going through those pattern of development, let us now look at this one. We have already discussed the typical development, which is the knowledge of which helps us in recognizing other patterns of development. Now, what if the child is not achieving milestones as expected? Is the child delayed? Okay. Excuse me. So delay pertains to a lag in one or more domains of development. Because delay in one domain may affect skills in another. For example, a child with severe motor delays may not have as many opportunities to play and explore, affecting the cognitive domain. So delay means not attaining a particular developmental milestone at an expected age, okay? But the progression is correct, okay? The sequence is appropriate, but there is delay in attainment. This is different from deviation, wherein you skip a milestone. That's a deviation. It's not delay, but something was skipped. An example here will be a child with autism who knows how to read books and count before they can say mama or before they share interest or interact with others, okay? So there's skipping of a milestone, okay? Delay in one stream of development while others progress smoothly is dissociation, okay? When there is significant difference in the rate of development. Like, for example, a child with cerebral palsy may display this as a gross motor skill lag, but they are doing well in terms of language, social, and some cognitive skills, okay? So these three patterns of development raise a red flag, okay? So red flags signify warnings. Clinicians or parents may note red flags in developmental milestones that are cause for concern. So we need further monitoring, we need to refer, and it's important to pay attention to this because it may be even a sign of serious neurologic syndrome or other conditions. So the parents may also exhibit patterns that are red flags for a child's development. If a parent frequently is insensitive to an infant's communication cues, okay, unable to recognize this, are easily angered by the infant or ignore the infant, and then there may be signs of difficulty with attachment. We look at the family support, okay? Parents struggling with depression or substance abuse may also have challenges promoting their child's growth and development. And they may benefit from learning how to provide developmental stimulation and opportunities for play and learning. So infants who do not alert to sound, who do not visually fixate on objects, or who do not smile should be referred for initially further hearing and vision assessments. Okay, so late social smile might suggest blindness. Okay, and then we look at the muscle tones. Okay, those whose muscle tone is too low to allow for adequate feeding or movement. An infant, for example, who rolls over before the age of 3 months may indicate hypertonia earlier than expected, okay? Or persistent feasting at 3 months of age, possible neurologic dysfunction. So there, we expect some primitive reflexes to disappear in time, and persistence of this is again something pathologic. Then we should be referred for evaluation. Hand dominance, which we do not observe prior to 18 months, okay, may indicate contralateral weakness. Okay, and the persistence of primitive reflexes may be a sign of neuromotor disorder. So again, when reviewing language development, do not overlook hearing. Okay, hearing impaired babies, remember, may still gurgle and coo. Okay, and one who says their infant can hear may have unilateral hearing impairment. So their early language development may appear to be normal. They coo, okay? They gurgle. So we assess hearing and then refer for a more detailed assessment. Also, when a child's speech is delayed, we also consider the possibility of cognitive disability. Children who are unable to walk well or walks late need to be further evaluated, okay? Remember, cerebral palsy is the most common neuromotor disability in childhood. So when there is no motor delay, there is no cerebral palsy. If this is ruled out, we have to check out for creatinine phosphokinase level in a boy who is not walking by 18 months of age for possible Duchenne muscular dystrophy, okay? We also look at eye contact, which is a form of nonverbal language. Lack of pretend play, ignoring other children when they are more than 2 years of age, may be signs of autism. So knowledge of typical development helps in identifying the red flags, and this become part of our developmental surveillance. And when do we do this? This is done at each child well visit to assess the development and behavior of the child. Okay? Developmental surveillance involves discussing with parents their concerns, taking developmental history, observing the child in the clinic, physical examination, okay? All of these are important and may provide clues on the cause or causes of concern. So when you do surveillance, you also do developmental screening at times, okay? Because developmental screening is what? Administration of specific assessments to detect disease or disorder in a child at a period when intervention would improve developmental trajectories. This is not intended for diagnosis. Remember, it's a screening tool. It's more for rapid identification of individuals at risk and who need further evaluation. So the American Academy of Pediatrics recommends screening children for general development using standardized validated tools such as the PEDS at 9, 18, and 24 or 30 months, or at any point when a parent raises concerns. We have the MCHAT, or the Modified Checklist for Autism in Toddlers, okay, to screen for ASD. And we have the pediatric symptom checklist to screen for ADHD, okay? Early identification of delays allows for referral for early intervention. And these children are more likely to make gains in developmental milestones. I would like to share with you this video on the importance of developmental surveillance and screening in our practice.
Hi, I'm Dr. Shelley Place. It may surprise you how common developmental disabilities are. About 1 in 6 children have a developmental disability, such as cerebral palsy, ADHD, or autism. If we identify children with developmental disabilities early, they're more likely to have the best possible outcomes. That's because interventions work best when given to young children when the brain is rapidly developing. Unfortunately, at least half of children do not benefit from early intervention because they're not identified until after they enter school. The American Academy of Pediatrics recommends a combination of both developmental surveillance and developmental screening. This combination is best to promote healthy development, prevent delays, and identify children with delays and disabilities as early as possible. Surveillance is flexible and ongoing and is something a healthcare provider should do at each visit. Surveillance includes asking parents about their concerns, taking a developmental history, observing the child, identifying strengths and risks, documenting results, and communicating with other providers. Developmental screening, on the other hand, involves using a standardized screening test, also called a screener, at specific ages recommended by the AAP, and whenever concerns are raised by the parent or pediatric provider. Screening rates have increased, which we are all glad to see. But keep in mind that it's the combination of surveillance and screening that improves early identification. They each have certain strengths which build on each other. For example, a pediatrician doing surveillance during a well-child visit may find a child is developing typically at age 6 months. But she may also detect certain risk factors, such as a parent who is depressed or who is not talking much with the child. In this case, by doing surveillance, the pediatrician picked up on some opportunities to intervene early to promote the child's healthy development. On the other hand, screening can detect problems not identified by surveillance alone. For example, a child with cognitive delays may not be recognized by a parent or in a typical office visit. So we should strive for high rates of screening, and we should also aim to conduct developmental surveillance at all health supervision visits. Currently, only 1/3 of parents report being asked by their child's doctor if they had any concerns about their child's learning, development, or behavior, a key component of developmental surveillance. In this video, I'll cover some strategies to incorporate routine developmental surveillance into your practice. The first 2 parts of surveillance are eliciting parents' concerns and obtaining a developmental history. Typically, these are done simultaneously by a healthcare provider using a strengths-based approach. Before asking about concerns, the provider might ask, what new things is the child able to do? What is he good at? And what new milestones has he reached? Look for resources you can share with families about developmental milestones and incorporate them into your practice and practice flow. This way, families will understand that you are interested in their child's development and that you value parents' perspectives. This will also help families recognize their child's milestones and communicate their concerns about how their child is learning, developing, and behaving. Good resources include the Bright Futures pre-visit questionnaires and CDC's Learn the Signs, Act Early, free resources and milestone tracker app. These provide developmental milestones you can review with families. While taking a developmental history and eliciting concerns, it's also a great opportunity to encourage families to read, talk, and sing with their child to foster healthy development. A third part of surveillance is making accurate and informed observations about the child. Healthcare providers are trained to observe how a child is regulating, interacting, communicating, and moving. These observations, along with a physical exam, can reveal developmental concerns. A fourth part of surveillance is identifying risks, strengths, and protective factors. The longitudinal relationship you develop with families gives you the opportunity to get to know their protective and risk factors. It is important to ask families about their family support, childcare, local community and religious supports, and any significant medical history such as prematurity or congenital heart disease, along with any adverse childhood events such as food insecurity, housing problems, or mental health issues. A fifth part of surveillance is documenting and maintaining a record of outcomes of surveillance and any next steps. You should have a system to longitudinally document and review a child's development with any concerns, risks, strengths, or protective factors. You should also document that developmental surveillance results were discussed with the family. If there are concerns, you should administer a developmental screener and take appropriate steps. If the concerns are significant, the child can be referred directly for early intervention and further evaluation. The sixth and last part of developmental surveillance is sharing and obtaining opinions and findings with other professionals. Good communication between the medical home and other care providers is essential to ensure optimal child development. It is important to work within your community and systems of care to determine how best to communicate opinions and findings. You may want to contact early child educators, WIC, home visitors, and early intervention programs to obtain their perspectives, including developmental screening results performed through their organization. Developmental surveillance is rewarding. It improves family satisfaction and engagement. Like screening, it is an important way that we can promote healthy development, prevent delays, and identify children who need intervention as early as possible, all to give children the best chance of reaching their full potential.
Okay. Now, that's the end of the lecture. And these are the key points in this afternoon's session. The developmental milestones of each child follow predictable courses, okay? And later developmental skills build on previous ones achieved, okay? Understanding normal development is important in recognizing delays in development. Again, gross motor follows the cephalocaudal progression. Okay, so that's why you have first the head control, and then they roll over initially from prone to supine because you move your shoulders first to turn around, and then later on roll over from supine to prone because then you will use your hips. Remember, cephalocaudal. Then you start to sit later on, okay, before that because of the truncal support, and then they stand up and then they walk, okay? And then never ignore a parent's concern, okay? So we ask the mother a concern. Remember, that's part of surveillance. And then we now have early diagnosis and early intervention will lead to better outcomes. You can have only early diagnosis if there is appropriate screening done, okay? So every child is gifted. They just wrap their packages at different times, okay? So that will be it. And these are our references. So are there concerns? The developmental milestones kasi, it's really, we can't do anything but when it's your exam. So parang may memorization part talaga, ano? Like at what age do we expect this to be seen? But you will also see in the textbook that these milestones develop at a range of age, okay? Some milestones, most milestones develop at a particular range of age. For example, they sit with support between 6 to 7 months, okay? They start to walk between what, 12 to 15 months. So it differs. Okay. Another important thing is we have to know the red flags. Okay, the red flag. So that means at this point, they should have met already this milestone. And if not, it's really a concern. Okay. You have to know the red flags. And then delay is easily understood, like language delay. Okay. Maybe it follows, they say mama, dada, but then at a later age, they have 2-word sentences at a later age. Okay. The sequence is still normal but delayed. Okay. While deviation is, again, you skip. Okay. As I have said, those with autism may tell stories, may read books, and skipping to say mama, dada. Another one is rolling over from supine to prone before prone to supine. Your clue there is cephalocaudal. If nauna yung mas caudal, na gross motor kesa sa mas cephalic part, that's deviation because you do not follow normal sequence. Okay? We have the dissociation. Okay? What was not mentioned is regression, because we do encounter patients who are talking and then later on will not be able to talk anymore. Okay? Moms would say, he used to tell stories, now it's just saying one word. No. Okay? We see regression in those victims of abuse. Okay? We have witnessed that. The developmental regression. Okay? Those who were physically abused. Okay? So mothers would complain, suddenly wouldn't talk. Okay? So these are also red flags. Okay? So I think that's all. Okay? So if you have nephews and nieces and younger siblings, sometimes it's easier to see the developmental milestones and associate it with their particular age. Okay, that's one clue again. Okay, but in the absence of none, just imagine them in the developmental milestones. Okay, kasi this topic is medyo more of memory. Okay, recall. Okay. So you'll now have your break and we'll just have to stay on. Okay, the remaining time is more for learning at your own pace. Okay, so kindly stay a little longer na lang. Okay, we don't want to hold you too long as well with straight lectures. Okay, so thank you everyone.
Thank you po, Doc.